Good afternoon. I'm Dr. Fred Venditti. I'm the Hospital System General Director here at Albany Medical Center. I'm joined today by Dr. Dan Pausé. Dan's one of our emergency room physicians, and he's also the Chief Medical Officer here at Albany Medical Center. We're bringing you the news from Albany Med today. So Dan, let's pop up the first graph. This is the COVID hospitalization numbers for the Capital Region. And you can see that we're at about 167 hospitalized patients. So we've dropped considerably, Dan. We were at about 553 at our peak. We've plateaued a little bit the last couple of days, but we've come down considerably. The next graphic here are admissions, discharges, and deaths. And you can see here that in the last week, we've actually not had double-digit admissions. I think one day we had 8, but by and large, relatively few admissions. And it's been almost 3 weeks since we've had significant double-digit admissions. So really a decline in our admissions coming into the hospital with a fair number of discharges. The final graphic is our morning census here at the Medical Center. And you can see on this we're at 48 inpatients, 11 in the ICU, 5 of those are ventilated. And Dan, I think a fair number of those 48 are non-infectious.
Yeah, I think over half of them are non-infectious at this time. So
yeah, and that's kind of been the case for a while for us, right?
It has been, yeah. A lot of the patients stay quite a long time, and during that time.
What's the average length of stay for the COVID
It's a little bit over 3 weeks, so it's for a number of different factors. So this is a very serious illness when people come into the hospital, and they require care for quite a bit of time.
That's right. So perhaps that's the bad news, but the good news, I think, is the vaccine, or vaccines, plural. So let's start with some statistics first. At the New York State level, we've actually given first dose vaccines to 2.5 million New York Staters. Isn't that terrific?
That's fantastic.
And actually, 6.9% of New York State residents have had their second dose, so they're fully vaccinated. In the Capital Region, Dan, we're doing even better, right?
It seems like, yeah. 165,000 members of the Capital District have had vaccines, first dose, and 7.9% of all residents in the Capital District have had second dose. So really good stuff.
That's tremendous. That's just really a huge accomplishment in a very short period of time.
Absolutely.
Yeah.
Great stuff.
So those vaccines that have been administered thus far are the Pfizer vaccine, which came out first, and then the Moderna vaccine. But I think we're on the cusp of a third vaccine, right, Dan?
Johnson & Johnson. Yeah,
That's
it's
right.
a one-dose vaccine as opposed to 2. So a lot of benefits in that in and of itself.
So the J&J vaccine is going to the FDA panel tomorrow for consideration to be approved. My expectation, and I think lots of people expect it, will get emergency use authorization by the end of that meeting tomorrow, which will be terrific. I think J&J is prepared to release 4 million doses right away, and then another 20 million in the course of another month or so. So that'll really help.
Great.
The FDA has published some of the statistics on the J&J vaccine, and let me just give you some numbers here. So at 14 days, the efficacy, or the ability of the vaccine to prevent infection, is 67%, which is really pretty good. It's above the 50% threshold the FDA requires, and that holds at 28 days, or 4 weeks, at 66%. If you're greater than 60, so they broke out the little bit older population, the 14-day efficacy number is 14%. So perhaps a little bit more efficacious in that older population. From a safety perspective, it's about the same as the other
Seems
vaccines.
like it, yeah. So about a 13% adverse event, or any issues such as fevers, headaches, muscle aches, things like that. So very similar to the other vaccines.
Yes. And in this study, they actually did something interesting, didn't they, Dan? They looked at 28,000 people enrolled in the trial, and they measured something in their blood.
Yeah, they measured the antibodies of these patients who have had the vaccine and then compared that with people who didn't have the vaccine.
And what did they find?
They found that it was somewhat similar, only I think a 13 or 14% difference between the two groups.
That's right. So converting or developing those antibodies means you've been exposed and probably been asymptomatically infected, right?
Yep, absolutely.
And so it doesn't seem like the vaccine changes the percent of people who have asymptomatic infections. And it's kind of interesting. We were talking before, there's another study from Great Britain on the AstraZeneca vaccine, which isn't available yet in the United States, right? But it too seems to not really alter asymptomatic infections, just the symptomatic. So how do we interpret that, Dan?
Yeah, very similar. I mean, the symptomatic, if we can reduce those, and it looks like both of those vaccines did that, what they did was decrease the amount of people who are hospitalized or have severe complications from COVID. So while people might have a positive disease, they don't have a severe disease, which is really great.
Continuing with the vaccine theme, tomorrow's a special day, right?
It is indeed. So tomorrow is the last day that 1275 Broadway will be delivering vaccines.
That's terrific. Tremendous effort on the part of lots of people. We stood that up quickly. We've delivered a lot of vaccine at that site. Real shout out to the folks that ran it. Dan, how many vaccines did we actually deliver there?
So we delivered over 19,000 doses total. It's really an amazing
Unbelievable. Unbelievable effort on the part. Thank you all for your hard work to make that happen. Now, we're not stopping vaccination in general though, right?
We are not. So the next kind of phase from Albany Med will be in our faculty practice. So we're now able to offer some vaccines when available to our own patients at 99 Delaware location.
That's right.
And those people who qualify now are over 65 years, but again, have to be a patient of the Albany Med practice.
That's right. And so that'll progress. It won't be the same kinds of numbers as 1275, but it'll still be important in terms of vaccinating our community. So we look forward to that.
Yeah, absolutely.
So one final thing we'll end today on, and this is about a scam that's going on that we want to alert all of our staff to. So licensed professionals, healthcare professionals, so think pharmacists, respiratory therapists, nurses, physicians, physician assistants, nurse practitioners, are starting to get calls from an individual that says, your license has been suspended. Please give us your Social Security number, and in order to reinstate your license, you're going to have to pay a fine. And it's apparently being followed up with some very official-looking paperwork coming in the mail. This is absolutely a scam, right? Do not respond to this. Do not fall for this. Be very careful.
These people are really crafty. They'll call you. They'll try to keep you on the phone. They'll bring other people in the call and say, you need to answer us right now and give us your money or else your license is suspended. So a completely very sophisticated scam and something that is going around to a lot of people.
Yeah, really, really a terrible thing, in this kind of circumstance with a pandemic going on, trying to prey on really the heroes in healthcare, providing care for our communities. So just be aware. So Dan, I think with that, we're done for today.
Great.
The weekend looks like it's going to be wet and snowy, so be careful out there. Stay warm and dry. We'll be back on Tuesday next week. Have a good weekend. Take care of yourself and take care of each other.